The honourable member for Banff Cochrane.
Thank you very much, Madam Speaker. It's an honour to rise here today and speak to this very important bill. And I'd like to thank my colleague from Edmonton Castle Downs for putting forward this very important bill. Many of my colleagues here today know that my background is a registered nurse, and I just wanted to share some of my experiences as well. I found it very moving to hear all of the different stories that have already been shared here today by my colleagues, and it just goes to show how prevalent post-traumatic stress disorder or those types of experiences can be. We're just in a small room here with only 87 or so people. We have a lot of members who have gone through these types of experiences. I wanted to talk about the experience I had in nursing. Within the first year of becoming a nurse, I had a patient who passed away. I was working at it's called a neuro step-down unit at the Toronto Western Hospital. It's kind of like an ICU, but not quite as critical patients there. But of course, things can change very quickly. So it was late at night. Working on the night shift is always kind of an interesting dynamic. You're up in the middle of the night when most of the rest of the city is sleeping. And you're there safeguarding these patients. And one of the routine tasks that we would do at night is give patients their baths. So it was a good way to sort of settle them down for the night and make them feel a little more comfortable. So this particular patient, he had been there for quite some time. And in the step-down unit, the patients always wear monitors all the time. So we've got the ECG heart monitors, the blood pressure monitors, and those kinds of things. And when those things stay on a patient for a long time, they feel really yucky. They get sicker, goo all over them. And so I wanted to give this patient a really good bath that night. So just as I was finishing the bath, I'd been chatting with them and settling them down for the night. I was just about to put the ECG stickers back on. And sometimes neurosurgical patients can be confused. So he started saying, "Oh, my chest, my chest." And I said, "Oh, what's the matter?" And he just said, "My chest, my chest." And so I, put the stickers right back on him and called for help. We had to call a code blue just like that. It happened immediately. And it turns out that the patient actually suffered from a thoracic aortic aneurysm. So there's one of your major blood vessels in the chest just basically tore apart instantly. And he died right in front of our eyes. And, being a fairly new nurse and having this experience, it stays with me all the time. I don't think about it constantly, but it's something I'll never forget. I always wonder, should I have taken those ECG leads off the patient? I was trying to give him some comfort and make him feel a little better. Knowing what I know about the condition that he passed away from, I know that having those ECG leads on wouldn't have made a difference in that case, but it's still something that stays with me. Maybe I should have left them on. Another thing that I wanted to share was that when I was a student nurse, one of my first experiences was on a plastic surgery unit. And I walked into a room. This was probably the first patient I'd ever seen in a hospital. I walked into a room, and a woman had had plastic surgery on her face. I think it was for some kind of mandibular cancer. And she had been fixed up, but of course, plastic surgery is not perfect, and the woman was quite disfigured, and she had, large scars on her face. And being the first time I'd ever seen a real patient, and there she was with a disfigured face, I had an immediate body language reaction. And I knew that was wrong because I knew the patient was watching me. And the patients watch what their care providers are doing because they want to see, what's it going to be like when I get out of the hospital? If the nurses react like that, how are regular people going to react? And so I felt horrible about that. But it also really made me conscious of the fact that as a healthcare provider, I had to take care of my emotions and have full control of my emotions at all times. And it's a very difficult thing to consider because of the range of situations that we find ourselves in. But patients and families look to us to be the ones that are solid as a rock. When things are going bad, the healthcare providers, they can't say, I can't deal with this right now, I'm going home. Because our job is to take care of that patient no matter what the circumstances are. And I know that that's the case in all different sorts of occupations. I know that in one instance we can be discharging a patient. He or she has had a long course in the hospital and they've gotten better, they've made progress, and they're about to go home. And with having a multiple patient assignment, you might then go to the next room and that patient is about to die. So you've got to go and change your emotions from one patient all of a sudden, having a great news story, they're going home, they've gotten better, and good for you, Mr. Jones. And then a minute later, you have to shift your emotions to match the mood in the room of the next patient. And so controlling a person's emotions like that, it can take a toll on a person. I'd also like just to talk a little bit about, we often think of frontline workers suffering from this the most. And that certainly is the most common, but there are other healthcare providers that aren't necessarily thought of as frontline workers that also can suffer from post-traumatic stress disorder. I think of, after having worked in the operating room, I think of a lot of the housekeepers. In the operating room, we start with a nice, clean, sterile room, and at the end of a surgery, depending on what it is, there can be blood everywhere. Blood on the ceilings, blood on the floor, blood all over the bed, like you name it. And, some surgeons will joke, if you don't get blood on the ceiling, you're not doing it right. It's kind of morbid, but sometimes that's how we have to deal with those scenarios. And so the people that have to mop the blood off the ceiling can also suffer from these types of disorders. And so I want to acknowledge those people. The people that do the laundry, they get laundry soaked in blood. And they have to think about the story that may have resulted in that situation occurring. And so I think there's a lot of unsung heroes that we have in our public services that are put at risk of these kind of emotional experiences that we also need to make sure that we acknowledge. I just want to use the last few minutes of my time here to talk about, as the member for Calgary Elbow had mentioned earlier, the impact of the 2013 flood on his constituents. And certainly the constituency of Banff Cochrane was widely hit by the 2013 floods. From Bragg Creek, Lac des Arcs, Exshaw, Harvey Heights, Canmore, Benchlands, almost all of the communities in Banff Cochrane were affected to some degree. And still to this day, when it starts to rain at this time of year, people get nervous. And I know I was at the post office the other day saying, well, isn't it good that it's rained in order to sort of combat the risk of forest fires? Because that was something that was top of my mind. And the person behind the desk at the post office, of course, reminded me that, this rain also makes people nervous. So there's a balance between events, and people perceive it in very different ways. I know that people are getting to the point where it's about close to getting to 3 years after the fact, but some people have just finished fixing their homes, and now they're at the stage where they say, I fixed my home, but now I've got to deal with the emotional stress of what I've just been through. They've been so busy fixing up their homes or repairing their business and dealing with those kinds of things that they're now just realizing what they've been through. And the effects of people that have been through the flood is so far-ranging, and we need to acknowledge and support the experiences that people have been through and ensure that supports are available for them on an ongoing basis. So just in closing, again, I'd like to thank the member for Edmonton Castle Downs for bringing this very important bill forward. And I'd also like to thank all the members of this Assembly for granting unanimous consent for allowing this bill to move forward in such an expeditious manner. Thank you very much.